Hello, thank you for joining us. I am delighted to be speaking with Helen Ryan today. She's a senior medical scientist in UHG in University Hospital Galway and a former Cleveland Clinic Innovation Award. And as you know, the Clinical Innovation Award is very similar to the Cleveland Clinic Award. Helen, thank you for speaking to me today.
Thank you, Stephen. I'm delighted to be with you today. Let me just start off by giving you a little bit of background on myself. As you said, Stephen, I'm a medical scientist. I've been working with the HSE for the last 21 years. So a lot of scientific experience and quality experience at my end. I came to the mainstream of GMIT, so I have a biomedical sciences degree, and then shortly afterwards I did a master's in Dublin on molecular pathology, and more recently I have master's in clinical research. So that's a little bit just on my background. So a couple of years ago, I started to dip my toe into innovation, and I suppose I got bitten by the bug. I was very excited about it, a lot of passion there for it, and I've kind of continued on that trajectory since. So I suppose it started out, I applied for the Cleveland Clinic Award in 2019, and that was really the start of it. So I was lucky enough to win a bursary of 15,000 as a finalist, and then the following year I was the winner of the regional Spark Ignite for 2020, and that's brought me to the point where I am now. So basically, I'm working with Enterprise Ireland on developing a new intervention in the domain of women's health.
So there's quite a lot there, particularly from your innovation journey. You dipped your toe, as you said yourself, and you were bitten by the bug, and like I'll attest to that. You have been a driving force for a few projects now at this stage, and you continue to do so. We might talk about them kind of as we go through it. But first, I'd like to just ask you about how did you get involved in looking for solutions to problems, in the first place?
Well, in many ways, I suppose I've come to a kind of an unconventional route. So, I was aware of the BioInnovate program, and, as part of the BioInnovate program, there's a clinical immersion piece where you go into the clinical area and you shadow the clinicians and the nurses and doctors who are working in that area. So I suppose I didn't have that level of exposure. So I was really relying on my own experiences. And, I kind of felt that, I really wanted to be in the area of women's health, and I felt it was kind of an underserved segment. So I started to identify needs, noted maybe gaps in care, and then I started to talk to people about them, and kind of over time combining it with desk-based research. So I was looking at publications and surveys and reports, and over time I was able to validate that, yes, it was a problem and not just for myself. So that was really where it started off. And then I suppose I was very much aware of, that Galway was a hotspot for innovation. And so there was a lot of support and experience around me. So I was looking to what others were doing. I was trying to kind of mimic a lot of what they were doing in terms of how they navigated the process.
No, that's super. There's I suppose I should mention the BioInnovate program. It is a program run out of NUI Galway, where it is needs-led, a needs-led program, where, as you said, the fellows, the candidates on the program learn how to identify a problem in the first instance, and then they go ahead and start developing the right solution for a large enough problem. And the more information be available on their website. So it's BioInnovate, BIOINNOVATE. You yourself kind of followed that methodology. You had a passion for female health and health technologies. And as you said there, you started looking at the problems in that space and then validating them using desktop research. That might kind of sound a bit daunting to some people. What is it? What did you do?
Well, I suppose when you start out in this process, you're kind of almost very guarded about your idea, because you think you have a great idea and no one else has thought of this before. So, but in order to give a little bit of momentum and perspective to your idea, you need to speak to people. You need to speak to people that experience the problem, and you almost need to immerse yourself in the problem. They talk about in innovation, they talk about this fail fast theory. So what you're trying to do is if it's not a good idea, and before you commit time and money to it, you need to kill it off. But in order to do that, you really need to understand the problem. So you have to follow have great knowledge of I suppose the patient care pathways, and almost follow the money and follow the patient, and see actually where are all the costs, where are the deficits in care, look at the competition, what's out there already. And I always kind of equate it really to, like, it's almost the equivalent of peeling an onion. So every layer of the onion that you peel back, you were essentially revealing something new that could affect your project. So it could be something that will stall your project or take you in a slightly different direction, or it could be something that will propel your project a little bit forward or further on, So what I would also say is you need to speak to the right people early on, so you get a bit of fresh eyes and fresh perspective on it, and this will save you time in the long run. In terms of competition, I would say, you're looking to differentiate yourself from those that are out there. So you naturally need to look at the competitive space. What are they doing, and how can you create what they call a USP around that? Even though I suppose I was coming relatively early in the process, I was also thinking about the solution direction, and you can think about that quite early, in the sense that you have to, it gives you almost something tangible to work towards. You could even do an early prototype, a very crude proof of concept. And this is really useful, because even if you go to talk to clinicians or investors, you have something tangible that you can hand to them, and it's almost a marker of progress. And as well, this is actually technically feasible, and you can start to build data around it. So look to, I suppose, stand out from the crowd and see how you're going to differentiate yourself from the competition. And when you're talking, like, for example, if you're talking about a medical device, one of the downfalls of a particular medical device might be prolonged ICU stay. So you're trying to nip that in the bud and, eliminate that aspect of it. Or it could be long theatre times. So you're trying to cut theatre times, because all of these is money and time for like a business model like the HSE. Also, I would say to you, create a network of support. So look to link in with the TTO office, the Innovation Hub yourselves have been a great support to me. Local enterprise office, I have a dedicated commercialization specialist in NUIG. So, and then over time, you may look to partner with a kind of an academic institution, and they can become a kind of a formal collaborator on your project as you move through the prospect of going for a comfund.
There's a lot there, but it isn't anything new. I mean, these are all the steps for people to follow when they're trying to move a project forward. And you mentioned that fail fast, which is key. Why waste your time and resources? Find out without spending much money or much time on whether this is going to go anywhere. Like you said, follow the patient and follow the money, because that's where the value will be delivered, and they're the ones who will ultimately either be using or paying for it. And again, I always pick up on this is speak to people who know what the problem is. And from a clinical perspective, those of you working in a clinical setting, you're at a huge advantage, because a lot of people outside the healthcare system don't have that access to people to understand the problems the same way you can. When you're talking there as well about the competitors, you can learn a lot about the competitors from Googling them. You don't have to do too much legwork calling to them or that sort of stuff. You can Google and find out, I suppose, is fair enough, particularly at the early stage. And you mentioned a USP, and that's your unique selling point, or the value of what it is that you're doing, and you can figure what that might be based on the gaps of what the competitors fit. Yeah, and again, networking is something that keeps coming up, and you did mention connecting in with the innovation offices, the TTOs, the likes of the Health Innovation Hub, and most of us are here to help and point people in the right direction. I know in terms of the Cleveland Clinic Award at the time, now the Clinical Innovation Award, Helen, it was, a lot of people think it's a straightforward process, and it isn't really. It's quite involved. Would you Would you kind of expand or talk a little bit about your experience with the clinical the Cleveland Clinic Award?
Yeah, definitely. I would say it's a huge learning experience. And essentially a lot of it has been new learnings, you know, and it definitely it did push me outside my comfort zone. Um, I I would say, like, you know, I had years and years of experience, technical experience and quality experience accumulated, but I suppose this forced me in a different direction, in the sense you had to put your business hat on. You know, you were looking at things like market reports, you know, gross profits, cost of goods, you know, market pull, you know, business canvases, you know, and you had to go through the process of looking at in a logical manner, really, is, you know, asking yourself the questions, you know, is this useful? Will the clinicians use it? What will it cost to make? You know, what's the regulatory path look like? Is there a reimbursement strategy out there for it? So there was a lot of figuring out. But I would say it is a process, and you can learn the process. And there's some fundamentals that remain the same, but actually the journey be quite different. But it's really you're building on what you know already. You might have to take a step or two backwards to go forward again. So that's really where it goes.
Like, that's a great point, that the fundamentals are the same. There are a number of things that, you know, you have to look at, like the regulatory pathway or reimbursement strategies, and, you know, IP or whatever else, your competitor analysis. But the journey is very different for everyone. And like, you can't really reiterate that enough. I can't anyway. And we have a document there as part of the supports for the Clinical Innovation Award about how you would go about the how-to guide in terms of kind of developing your idea, or again, the application itself. Helen, the Clinical Innovation Award itself, once you won, I guess that wasn't the end of it. You didn't just get the money and you could go off to a beach. There was another step to it. You had to commission a report. Would you mind talking a little bit about that?
Yeah, I suppose in the process, that's very much your ground zero. You know, you're really starting at a low base there in terms of, but you have financial backing. So you have 15,000 euro that has been committed from Enterprise Ireland. And that's really, for the most part, to be used for a market analysis, because one of the things that Enterprise Ireland look for is sound, rigorous analysis before you set out on your journey. So you want to be starting off with a solid base, with a solid plan. So I suppose the main aim really here is to de-risk the process, so that you, before you commit time and money to a project that's going nowhere, you've killed it off, you know. So I would say, you know, just a couple of points about that process is, you know, you will get some provider, be it an individual or a company, to undertake a market analysis for you. So, but you have to go through the NUIG procurement process. So this requires you to get three quotations from 3 different companies or parties. And I would just say, you know, when you're looking to get somebody in this space, is look for someone with a good reputation. You know, look at their previous reports, look at the content, look how detailed they are, and look at the KOL aspect. So you want them to have good KOL reach. So this is where they have spoken to clinicians and are experts in the field, and they're able to give you a good summation of, you know, what is likely to be the market pull for something like this that you're trying to do. I suppose another point, I suppose, about the market report, it is really a form of external validation. So what it's really telling you is, actually, we have tested your assumptions, and you know, based on the feedback that we've got in this report, actually there's others there that totally agree with you, and so they give you almost the green light to go ahead. My market analysis that I conducted, in some respects, it was a huge learning curve really for me, because I was going back to the drawing board and I was saying, okay, I have a very good idea. This is a real problem. But when I considered there was great resistance change in the area, there was the possibility of, you know, clinicians were worried about patient risk, and there was a limited market. So overcoming that resistance change would have been difficult in the context of moving the project forward. So on that basis, that project then was shelved for now, but maybe revisited in time. You never know, Stephen.
No, you never do know, and like that, resistance to change could be a generational thing, depending on who's working in the space or who the key influencers are at the time, or it could be a technical barrier or something like that where it can't integrate properly at the moment. So it's always worth your while having this work completed so that you can jump off again when the conditions are correct.
And sometimes it's timing as well. So, you'll even see in the context of COVID, you would have a lot of new test methods that were introduced during that period. And, that might never have come onto the market. And that's really on the back of maybe they've paved the way for a lot of those test methods now, having, but with, I suppose, the positive impact that the industry has seen in light of COVID.
Yeah, absolutely. For possibly point of care diagnostics, we all know how to do antigen tests now at home, etc. For COVID, which would have been unheard of 2 years ago. It really wasn't going to be in the public consciousness, or we just didn't see it coming. And again, there was huge leaps forward in, say, telemedicine and a whole other load of solutions that came into play, not just in one area in healthcare, but in many, leveraging new technologies, etc. So yeah, timing can go both ways. You mentioned as well that you worked with then UI Galway through the tech transfer office here, and then they assisted in terms of you had to use their procurement system, and that's I suppose that's just something for people to be aware of, that the public sector universities, IoTs, technical universities, they were subject to public procurement regulations and rules, so we must follow them. So yes, you will need 3 quotes, but the universities or these different groups would know who to point you towards. And like you said yourself, it's worth your while doing your due diligence on those people. What is their reach? What have they done in the past? What's their area of expertise? Who do they know? They're you put it really well there. They're key opinion leader reach, which is hugely important, because it is all about opinion, really, at the start, an objective opinion, and where that market pull is. Okay, I think I know you. Just we'll touch on this briefly, Helen, before we wrap up. The Cleveland Clinic Award was probably your first step, and I suppose this is just for people to understand. It might be for now the last step on that particular project, but it didn't stop you. You've gone on to another project.
Yeah, so I suppose I just secured a commercialization feasibility grant from Enterprise Ireland of 15,000, and that's to progress an idea in the female health domain. So I'm going to use those monies now to undertake a market analysis. So again, that's quite a sizable task in the sense of all the tasks and deliverables that have to be done within that. And that'll be conducted generally over a 3-month timeline. So before, October, November, I should have a completed market analysis report, and that will give me good direction as to where I'm going on the project. In the interim, I'll have a series of meetings as well with the providers, and just to get a sense of, where the project might be heading. Aside from that, I suppose I'm going to the US to speak with investors and researchers this year also. So that'll be a big trip also, and it'll feed into the ultimate aim, which is the end of the year, really, to submit a commercialization fund to Enterprise Ireland. And that'll be a more substantial funding, hopefully all going well. Yeah,
and we have spoken to in some of the other pieces in this series, people who are on commercialization funds, so they can, if people want to have a look to learn more about those, you can. But it is, as you said, it's a sizable amount of funding to really move the project forward, to bring it towards market. So you have a lot going on, Helen, which is it's fantastic to see, and your drive and your passion for it is always a breath of fresh air. It is great to see it. Like you really do take it with both hands and go for it. Last question, and we'll leave you alone. What advice would you give to people thinking of applying for the Clinical Innovation Award?
I suppose I'd just say get involved. We all know there's plenty of scope for improvement within the healthcare system. I don't think we need to outsource it to a big brain. You know, the creativity and the innovation side, it's all there in-house, and the supports are there to navigate it. So really link in with the innovation hub and then help you navigate that process, I guess. I suppose for me, I'm thinking it's a very different, like, cultural aspect, really, because what you're trying to do is reward creativity, and as opposed to decisiveness, which is your typical job spec, you know. And just some general points, I would say. You know, consider your domain experience, and try align your project with your core competency. So that gives you great weight when you go to speak to somebody. So you understand the science, you understand the problem, and really do immerse yourself in the problem, follow the patient, look at the care pathways, and look at where there's gaps in the service. You know, look to build in a team. Your team is incredibly important, because and try and fill the gaps in your CV. So if you're strong technically, look somebody that would be stronger on the business end or the commercialization aspect. Another thing, surround yourself with those that want you to succeed, like-minded people. There's loads of them in the HSE. You know, they're all running projects. Avail the supports of the Innovation Hub, create links with the TTO office, NUIG, the academic partners there, and then try and create an attractive project, you know. And when I talk of attractive project, I suppose it's trying to find that sweet spot of innovation, you know, that you're trying to tick the box of desirability, feasibility, viability. In other words, do they want it? Will they pay for it? You know, can you do it? So you're starting off with an initial problem, and then, but you have to tick the boxes. Is there a market there for you? And sometimes it's a substantial market, and other times it might be just a niche market, but there's an absence of competition there. And the biggest thing of all is, you know, be a keen listener, you know, be receptive to feedback. It'll save you time. It's very much on trend. Pivot if you need to. And that's my 2 bobs.
There you go. Thank you so much, Helen. Really appreciate your time.